Hi everyone, Becca from Scratch here. Hope you're having a great day and thank you for joining us on this really important live today. So as you may have seen from the promotion for this live, this month is World Menopause Month. We also have World Menopause Day coming up very soon, and today I'm going to be joined by, sorry Erin, I'm just adding you in. Today we're going to be joined by Erin Searle, who is Katie Barnes' Product and Social Development Manager, and we're also going to be joined by Dr Berrin Tezcan, who's the CEO of Grosvenor Gardens Healthcare. Both were featured in our October issue, where we did a feature all about menopause, and they have some fantastic insight to share with us. So hopefully, Erin, you should be coming in now. Fingers crossed. But of course, if you have any questions at all, please do put them in the comments, and we can hopefully answer them for you. As I say, these two have lots of insight and knowledge about this really important life stage. So we really want to find out how you can cater to menopause in your business. So I can see you both there. I'm just trying to add you in, hopefully. Any moment now. I'll send you both an invitation and hopefully you'll join. And for those that are watching and maybe can't watch the whole live, do not worry, because this will be available after on our Instagram, on our YouTube and on our website. So plenty of time to watch it and get all of the knowledge that we need. So it says it's adding you, Erin, so hopefully. Let's try again. We've got someone there, I feel. I think that might be Erin. And I'll try add Dr. Berrin in now. And then we can get chatting. Hello.
Hello, hi, how are you?
I'm good, thank you. Thank you for joining us today.
Thank you.
Hopefully Erin will be here in a sec. Oh, she's gone. Let's try again. Thank you for taking time out of, I know you've got a very busy schedule, haven't you? So
no problems. Happy to join.
Oh, thank you. So hopefully she's coming in. While we're waiting for it, why don't you just tell those watching a little bit about what you do for those who don't know?
Okay. If you can ask your question again, because I was just trying to adjust my settings.
Don't worry. So for those that don't know what you do and don't know about Grosvenor Gardens Healthcare, tell us a little bit about that and sort of what you do.
Of course. So I'm a consultant obstetrician and gynecologist for many years. So I worked in the NHS for many years. Then I'm proud to be, as a woman, to start my private practice in Dulwich. Then we expanded to Belgravia. So Grosvenor Gardens Healthcare is a private gynecology, obstetrics and pediatrics clinic, and we see all women of all ages. So it's really it's a wonderful business. So yeah, I have a lot of experience in gynecology and pregnancy. So it's really I think that I can be quite a benefit in terms of having answering a few of your questions. So it may help other women or men to understand what's going on menopause time.
Oh, you're back. Okay. I should say hi, Erin.
Hi,
Sorry. How are you?
I'm good. How are you?
Good, thank you. Thank you for joining us as well. So Dr. Berrin just shared that about what she does, but why don't you tell us about what you do, sort of what your role is?
So I am a part-time nail technician now, and I'm also a product and social development manager for Katie Barnes Tool Range and Education. So yeah, quite a busy role at the moment, seeing clients and working for Katie as well.
Yeah, amazing stuff. And so sort of the reason you're here today as well is you've had some experiences with menopause, which we'll talk about a bit later. But first of all, so it's World Menopause Month. Obviously, menopause is an incredibly important topic to talk about year round. But why do you two think that it's important to sort of mark this event and promote awareness?
I'll let Dr. Berrin go first if you like.
Of course. So menopause is, women live more now. So we live like, may say 80 years, 90 years. So some significant amount of our life will be during this time of menopause, perimenopause, menopause, postmenopause. So, and we have ways to manage that. But we know that it may cause, for some women, not all of them, but for some women, it may be quite a challenging time because it's hard to understand where you are in that period. And symptoms may be, a variety of different symptoms that women may experience. And most of these symptoms are really causing inconvenience for their private lives, for their work lives. So finding a solution with them, so we see them how happy they are once we can manage their symptoms. So yeah, it is. I think it's a very important subject. I'm also in menopause, and I started my treatment a few years back before I was postmenopausal. But also, I was just, not all women will need treatment, but treatment makes a huge change for some women suffering from menopause symptoms.
Definitely. And Erin, what about you? Tell us a little bit why you think it's so important to sort of promote awareness.
It's good for everybody to have awareness because not only it helps the person going through it feel comfortable in what they're feeling, and if there's not that much awareness, I've been in places where they're not really aware, and when you're going through sort of like flushes, or like I suffered with rages quite a lot, like big mood swings, and when people don't understand, it makes it that bit more difficult. So raising awareness for it so people understand the different symptoms make it a lot more easier for the person suffering, I think.
Definitely. And I guess it is, we have come a long way, but it's still quite a taboo topic. So, if you feel you can't bring it up, then that also makes it hard, I guess.
Yeah.
Definitely. And so why don't you tell us a little bit about your personal experiences then, Erin?
I suffered with endometriosis for a while and had to have an early a hysterectomy, followed by ovary removal a few years later, which then put me into early menopause from that. And there's not a lot of knowledge around that. And I did a lot of my friends and things like that are not experiencing the same thing. So I felt sort of like I was very much on my own, struggling to deal with the symptoms, and nobody gave me any information of what I could be experiencing. And when I went to my GP, they didn't really look at my notes or even see that I'd had a hysterectomy, and misdiagnosed me with depression.
Oh my God.
And prescribed me antidepressants, and said that I was too young. And I get that a lot. I get, when I talk about being menopausal, I get, oh, you're too young. You're too young to be going through menopause. Because it's not a thing spoken about at a young age of 30. So yeah, it's been quite an experience, an eye-opener.
Amazing. And Dr. Berrin, I just wanted to ask you, obviously you were talking there, Erin, about people say, oh, you're too young, but I guess I know there is like an age bracket where menopause often happens, but it can happen to younger people too.
I see, I wouldn't say that very rarely, but we see young women, they come because they have irregular cycles and Generally, they were told that they may have polycystic ovaries because they have longer cycles. And then ultrasound is very helpful. So I'm quite good at, scanning, and I had very good training, a lot of experience. So sometimes the scan shows better than blood tests, because blood tests will become abnormal. To diagnose on the blood test is quite a while after perimenopause. Women will start the change in the hormones in their body, but when you do send it to the lab, it will be within the reference ranges. But the drop in the hormone levels will cause all these symptoms, and these symptoms are worse. In the past, I don't know how is Erin's experience about it, but it's worse for 2-3 years. Then the symptoms ease afterwards. So if a woman wants to reduce the dose of their HRT, they could do after a few years, because the effect of it is more important when you are mostly around perimenopause stage. So perimenopause, early menopause, it helps really a lot to women, to cope with all these, challenges in life, because they will be really affected with your hormones. My first experience was, I'm a gynecologist, but you never know until you leave, go into that. I was working on my computer, and my laptop was on, on my legs. And I said, oh my God, my laptop is, I think, getting, broken or something because it's too hot. Then I just, no, my laptop is not hot. What is hot? Then my legs. So that is how I diagnosed these hot flashes. It's a very different feeling, though. It's not like, you say patients about this, but if you live it yourself, it's very different feeling. And when I forgot twice where I parked my car, it's not me. And I said, okay, so it's maybe time to try for HRT. So there are different symptoms: hot flushes, night sweats, sleep problems, mood changes, joint pains, feeling tired. So these are all, vaginal dryness, so more painful sex, loss of libido. These may be all, symptoms of, perimenopause. And that can be, associated with something else, because some young women, nobody will suspect that they will go into menopause or early menopause. And especially at that age, there's also impact of, fertility as well. So it's really important to diagnose those women timely before, they can freeze their eggs, they can, freeze embryos. So it helps from the fertility point, as well as the risk of HRT is quite small, almost no risk up until the age of 50. So if they go into menopause at the age of 32, 35, let's say, then that 15 years, they will be suffering from a lot of postmenopausal side effects, like osteoporosis. So this is important for a young woman to have the bones to be thin, and then having these osteoporosis symptoms later on, it will be a lot of impact on them. So they should be on HRT, where, if they want to be, during that period is very important for their long-term life and living a healthy life.
Definitely. And you sort of
Ultrasound shows better than blood tests, so that's very important to look at the ovaries, see how they look, how is their ovarian reserve looking at. And if we suspect, of course, we do further tests like AMH level, so that checks for the ovarian reserve as well. And in the context of the ultrasound together, we put the patients on treatment. One of my lovely patients, so she was going for too many doctors. So she said the past 2-3 years, they couldn't find what's going on with her. So I just looked at it. I think your, blood tests are normal, but your ovaries looks like you are perimenopausal. You're 32 years old. Then we put her on the HRT as a trial for 6 months. And she said, all symptoms, everything completely improved. So it helps, but it's important to assess the patients, and each patient is different. Young age, it's good to be on HRT because the side effects are minimal, and it makes a big change for their life going on. I don't know how you did, Erin. So did you start on HRT or?
I tried, but I found that my mood changes were a lot more, and I felt like I could manage, because I suffered with like the sleep problems, quite a lot of insomnia, the mood swings, brain fog, and I've tried to just build a bubble around me where everyone that I am around with daily kind of understand how I am and if I'm having a bad day, rather than having HRT. But it is something I'm looking at, because I've had with clients that are going through menopause, they've said how much it's helped them and changed their life and made their symptoms a lot smaller. So it's something I'm definitely looking at doing to improve myself.
are some patients, they can't be on HRT for different reasons. It may be a breast cancer, it may be they're high risk for some diseases that they can't take HRT. So it's really challenging for them. So it's very important that people around them, knows what it is and, understand their needs. So it's very important because HRT is a medication, so it comes with risks and not everybody is suitable for HRT. So it's, and the dose can be reduced in time, so it can be managed. So it's all about balance of, what's the benefit and what is the risk. And we want to be, at the end of the day, as doctors, we want our patients' life to improve. That's what we want. If they're suffering and if we can help them, we try ways to, to see which will suit them most. But, at younger age, it makes a, you can, I was speaking to Sky News yesterday. So they asked me the same questions because there are some, dietitians around, they say that they reverse the menopause. You can't reverse it. And it's not something that can be reversed. Some antioxidants also, they will, they can manage mild symptoms initially. But at the end of the day, those 2-3 years may be, challenging for women. And as I said, you don't need to be on HRT for whole your life. At some point, you reduce the dose and you're coping well. So at some point, women can stop HRT. But it may help a lot with the initial changes. So, but obviously it's an assessment for each patient, just checking their risks and benefits is important, what they want.
Definitely. And Dr. Berrin, you sort of mentioned it there, but I wondered if you could sort of explain the different stages of menopause, because obviously you've talked about perimenopause, but I don't think people are quite aware that there is those different stages, obviously with different symptoms, that may occur for different lengths.
I think now the awareness is really good in the population. So women are more like, I have these symptoms, maybe it's better I, go and see a gynecologist. So maybe I can fix these with, if it is perimenopause. So perimenopause is the time period leads to menopause. Menopause is for 12 months that you don't have any periods. And after that is postmenopause. So perimenopause, some women will be having their periods regularly. They will be ovulating, on and off. So sometimes there may be a little bit irregularities, shorter cycles when we get older. But it's not always that the blood tests are abnormal, showing menopause when you're perimenopausal. But that is the time, I think, women, in my experience, personal experience and what I see from many patients, that's the worst time. We don't see a lot of women complaining a lot when they are 55, 60 years old or, older. But between 45 and 50, women, when the hormone level starts dropping, although when you do the laboratory reference ranges, they fall in the normal ranges, but the levels drop and their body's response to that is different. So some hormones in the brain increases when your ovaries stop working in order to push your ovaries to work harder, and that affects the thermoregulatory system in the brain, and it's worse in the first 2-3 years, hot flushes, night sweats, and they tend to improve in time as any other symptoms of menopause. But some women will need it, so they benefit from it and they want to continue, and they can continue as long as they want, provided that they do their checks, they do their mammograms as required, they do their breast ultrasounds, or they do their gynecological appointments, and they can continue with HRT if they benefit. But it's always, every patient is different. Some women, they come to me, they say, I'm having my regular periods, it stopped 3 months ago, and I don't have periods anymore. We check, it's postmenopausal, they don't have any symptoms. So, and there are different ways of managing those patients. They don't need to be on treatment for HRT, not everybody, but it makes a big change.
Amazing. So, Erin, obviously you were talking a little bit about your experiences before, but how did this, your now role, and sort of what has helped you going forward to manage your symptoms and feel comfortable in the workspace?
For feeling comfortable in the workspace is what helped me the most, was being open and talking to my clients about it. And it was then that I realized that it wasn't just me, like most of my clients are feeling this as well, because I would sit there in silence and feel like a hot flush coming over me and just have to be quiet. And when you're in a salon environment, your client is your priority. So if something is coming over me at the time, I'd sit there, and then I'd then, after my appointment, and I'd sit there and I'd be so emotional because I've held everything in. So eventually I was like, I've just got to talk to people about it and make myself feel comfortable, because otherwise I'm I'm just felt like I was going crazy. And just the awareness side of it. And sorry, what was the other question? In how?
I was going to say, how did it affect your nail tech role, really?
It made me research more, especially when I found out that my clients were feeling the same thing as well. Doing more research on how I could help them, what would benefit them. I started introducing more massaging, hydrating treatments, and doing the same on my own because I noticed differences in my own nails. So from my experiences, helped me help my clients in hydrating and massaging and things like that. Just made me more aware and want to learn more about it to help my clients and make my workspace more comfortable.
Definitely. And so how did you go about making that first step to sort of being open? Because I know that is really difficult.
I'm quite a chatty person, so I kind of just start saying, oh, excuse me, I'm just having a bit of a hot flush, and that then opens the conversation to the client. And I'd have a fan. At one point, I had a fan, those ones that go around your neck, and you have the two fans in front of your face, because my face was where I'd felt it more than anywhere else, and my whole face goes red. I still get them now. A couple of days I was just up at Katie's head office as well, and yeah, they had a fan on hand in the office, and I just sat with the fan on my face. So yeah, talking about it openly, just saying I'm just experiencing this, and that opens. You'd be surprised how much that opens the door for the conversation with your client, and the amount of things I've been told. They just open up and just openly talk about it, so then they feel comfortable. I think I've done that with pretty much every client now, so they all talk. Yeah,
that's so good. And then you're creating that space for them to feel they can be you as well and talk about it.
Definitely.
And so you sort of mentioned about changes to nails, but I wondered if I could ask both of you sort of what are some common nail symptoms of menopause?
Do you?
Experience, and I can go a little medical.
With myself, I've noticed my nails are very thin, very brittle. If I don't have anything on them, they break, and they lift a lot. So I can either be really oily or really dry. So I notice the changes throughout the month, and I have to have something on them, otherwise they break. So that's what I recommend. My clients are the same. They need to have either builder gel or aquagel. I find that they don't really get on with acrylic or hard gel. Aquagel is the best thing that I've found, which is that hybrid between acrylic and hard gel. It's quite a soft, light product, but is enough to keep their nails nice and strong and short. They like them short as well.
Definitely. And what about you, Dr. Berrin?
Medical point, I think, because of the ovaries reduce working and they stop working, the lack of estrogen, what ovaries secrete is estrogen, progesterone, testosterone, a little bit of testosterone as well, which helps with libido. So when these hormone levels are dropping, then low estrogen levels will cause dehydration as well as reduce collagen synthesis and keratin as well, which is a protein. So that makes the nails prone to, breaking, and texture may change. So, and with the hormone treatment, we don't, recommend just for that reason to have hormone treatment. But we see women, if they are suffering from, few other symptoms and they want to try HRT, we see that there is an improvement with, if they are suffering from nail issues. But, there are other treatments like, Erin mentioned that, increasing the hydration may help those women as well.
That's amazing. And so, if someone's watching this and, we've had someone comment and say they have a lot of clients who are going through menopause, what would your top tips be to sort of manage it, accommodate this in the nail space?
I would say having leaflets to show, like awareness leaflets, or posting on your social media that you are a safe space for anyone that's going through menopause, and sharing top tips, because they are everywhere. You can find them, and share them to your stories, share them to your grid. So, and then people kind of then see that you are open to talking about this as well. And then when you're in salon, having things available for clients, like if you have a little fan on the side that you can have if they're experiencing a hot flush, or cooling flannels. So if they are having a hot flush, that you can place on their hands or their arms. Little tips like that, little things go a long way with clients that are feeling like that. And I've also seen somebody recommend that sending reminder appointments as well help people with their brain fog and forgetfulness.
Mm.
Mhm.
Yeah, and Dr. Berrin, do you have anything to add to that?
I think, it's just that, my hairdresser knows a lot about me than anyone else. I think you have that opportunity to have a relaxing, because we're always busy on our phones. They can't use the phones when you're doing their nails. So it's really good opportunity for you, I think, to have a nice, relaxing, comfortable environment for women, so they can openly ask if they need anything. And reminders are important. Brain fog, I see women, they come with all the questions on their phone, because they say that, before my appointment, I wrote them because I don't remember. And sometimes they talk all over the place, and I just struggle to understand. I said, let me ask the questions, then you answer my question. Then 6 months later, after the treatment, they come, they're a completely different person. So it is really important that, this is a lifetime, and it will be a few years. It won't be like women after the age of 47 will be, like this forever. It's the first 2-3 years is challenging, and understanding that, and trying to help women. Not everybody will want to be on treatment. Some women, they don't want hormones. That's absolutely, we understand that, but those 2-3 years will be more challenging for them. And environment may be hot, so having, as you said, a fan and reminders, and if they need anything, understand, oh, no worries, of course, and then talk about these things maybe openly, because I find it very comfortable when I go to my hairdresser, having chat with them. It's really nice. So it's the same for you nail specialists as well, to have a chat with them and just making it normal in our lives. That's normal. So all women will go into that period, and that's a normal thing to happen, and they will have different needs at work, at home, that we can manage them with hormones, but we don't have to, and they don't have to. So if they don't, then we need to help people to get through that stage easier and not suffering much.
Amazing. And so you've both sort of mentioned this throughout, but for those that are watching and that are experiencing the menopause and maybe really struggling, what would you say they need to do? Where do they need to go to find help and support and maybe treatment?
I'm gonna give this question to Dr. Berrin.
I mean, it is, they can, just making people around them aware of this. So there is something like menopause. Men are not very good with that. So explaining their children that, that is, sometimes I may be more anxious, anxiety. But then I think the best thing is, seeing a gynecologist and seeing someone who has a lot of experience with different symptoms. So if the only symptom is vaginal dryness, they don't need to be on systemic HRT. We have some other treatments, that more local treatments, that they can consider using them. It depends on the symptoms, how women are suffering. And okay, diet change, lifestyle, it's important, losing weight, that makes it better, the symptoms managing. But if the symptoms are severe, I think, there is, we can more seriously discuss about the available medical options. It's not forever, as I said, for a few years, because women think that, I'll be on this and it will be forever. No, this period is hard for, 3-4 years, let's say 5 years, but then, the dose can be reduced, because there's still benefits on the bones also. You don't need to completely stop it if you don't want to. But I think, being open and explaining to the people that are around you at work and and then see whether, how you feel about being on treatment. If your symptoms are really, uncomfortable for you, or mild symptoms, you can still, have some advice on how to manage exercising and, maybe changing your diet. It will help for initial symptoms. And also perimenopause is a challenging time, and it's more likely we see those symptoms at that stage more than postmenopausal women. And what I would suggest that, they just need to look at it more broad view and monitor these symptoms. And also some of them will have, because of the hormonal imbalances, some heavy periods, irregular periods. Then there are different options that, also they may need some contraception. So we use as a progesterone arm a coil, which is, hormonal coil. and then they can still use their estrogen safely. So there are different treatments, but it's important for them, for me, to understand how they suffer from menopause, mild, moderate, severe. Then I think there are different treatment options for all women there. But changing lifestyle is personal decision, and we recommend it. But changing lifestyle helps a lot as well.
Yeah, I definitely agree with that. I changed some of my diet, and I've also stopped drinking caffeine, and taking the caffeine out of my diet has helped massively. I've noticed that a lot.
Right. And I think what you sort of both touched on there is it's important to know that it is completely personal, isn't it? Every woman can experience it so differently.
Yeah.
So just be aware of the symptoms, and then, you know, it might affect you differently to how it might affect someone else.
Absolutely.
And so let's finish by, why don't you both tell us where people can find you if they want to get in contact or see what you're doing?
So with me, do you want to go?
Yes, you can go first. Yeah.
You can find me. I'm normally over on Katie Barnes' Tour Range page, or my personal one is I'm normally over on Instagram, which is Erin Searle _. I'm normally over on there.
Amazing.
So I'm Dr. Berrin Tezcan. I'm a consultant obstetrician and gynecologist. As I said, I'm the CEO of Grosvenor Gardens Healthcare. So our clinic is based in Belgravia, our central London clinic, which is 5 minutes walk from Victoria Station. And our other clinic is in Dulwich in Southeast London. And we do provide gynecology, pregnancy, private delivery options, and we have pediatricians, physiotherapists, dietitian working with us. So we work as a team, multidisciplinary team. But our whole aim is to make, our patients' lives better, and to teach them, to make sure that they understand and they make their informed decision when we are going through their, problems, and then when we are providing them treatment options. So yeah, we have 2 locations. So we are, we have I see my patient, I see her mom, I see her daughter. So it's really nice that we are a big family now. For quite many years we provide private service, and NHS struggling, we appreciate that. Where we can, we try to help from the private point. NHS is great, but it is busy. So sometimes its delays are, inevitable. So we are here as private clinics to support NHS, where, to improve the diagnosis, to make sure that patients do not suffer and wait too long when they need a treatment. So we work together with NHS, and we are happy to see patients and help them.
I'm
Amazing.
gonna be booking in.
Yeah.
Of course.
Amazing. I should say, we've had some more comments there. It's really positive to see conversations happening in this space about this, as it affects so many, and it's great to shed any stigmas about talking openly about this, which is amazing.
Yeah.
Thank you very much. Thanks for the opportunity.
Thank you so much. You shared so much insight. It's been fantastic.
Thank you. Thanks a lot.
Thank
Take care.
you.
Bye.
Thank you both. Take care.
Thank you.
Bye.